Surrendering your consciousness to another person, general anesthesia, is one of modern medicine's greatest achievements. It enables life-saving surgeries that would otherwise be impossibly painful. Yet, the idea of being put under triggers a deep, primal fear, the loss of control, the unknown, and questions like, what if I don't wake up? Hollywood often amplifies these fears, but the reality is far safer and more controlled than most imagine. Today, we'll demystify general anesthesia, exploring what really happens to your brain and body, and the science and safety behind it. By replacing myths with facts, we can transform fear into reassurance. Let's see why this medically induced sleep is not a terrifying void, but a protected, remarkably safe journey. Think of your brain as a bustling network of neurons, constantly communicating to create consciousness. General anesthesia doesn't just quiet this network, it temporarily disconnects it. Anesthetic drugs target synapses, boosting the calming neurotransmitter GABA, which silences neural activity. This results in 4 key effects: unconsciousness, amnesia, pain relief, and immobility. Unlike natural sleep, anesthesia is a controlled, reversible coma, deeper and more profound. Modern drugs are precise and quickly eliminated. As their levels drop, your brain's orchestra resumes, and you awaken from a deep, dreamless slumber. The process is engineered for both safety and predictability. It's not just sleep, it's a carefully managed state that allows surgery without pain or trauma. Your anesthesia journey starts with a detailed consultation, not in the operating room. The anesthesiologist reviews your medical history, medications, and lifestyle to craft a personalized plan. Every patient is unique. Factors like age, health, and surgery type shape the approach. On surgery day, the team checks every piece of equipment, from gas supplies to emergency drugs, following strict protocols. This preparation is as thorough as a pilot's pre-flight checklist. The team coordinates with surgeons and nurses, ensuring everyone is aligned. All this happens before you even enter the room, creating a controlled, safe environment. Their meticulous planning is your first layer of protection. Anesthesia awareness, the chilling thought of waking up during surgery, is a staple of Hollywood horror films, often portrayed with dramatic intensity. These cinematic depictions can understandably fuel anxiety, but it's crucial to remember that this is not a common reality in modern medicine. The advancements in anesthesia and monitoring techniques have significantly minimized such occurrences. Modern monitoring systems, including sophisticated brainwave devices like EEG, play a pivotal role in ensuring patient safety. These technologies allow anesthesiologists to closely detect and prevent any signs of awareness long before it could ever become a distressing experience for the patient. They provide real-time feedback, enabling immediate adjustments to the anesthesia levels. Fears of blurting out secrets or revealing private thoughts during surgery are also completely unfounded. It's a common misconception fueled by misunderstanding. Under general anesthesia, your higher brain functions, including the areas responsible for conscious thought and speech, are completely offline. You are in a state of controlled unconsciousness. The risk of not waking up from anesthesia is extremely low, a testament to the advancements in medical science and the expertise of anesthesiologists. Statistically, it's about 1 in 200,000 for healthy patients undergoing routine procedures, highlighting the remarkable safety of modern anesthesia. That makes it far less likely than being struck by lightning, putting the risk into perspective. Anesthesiologists are highly trained medical experts, specializing in managing your vital functions and ensuring your well-being throughout the entire surgical process. They are also skilled in safely reversing the effects of anesthesia, allowing for a smooth and comfortable awakening. Another common myth is the idea that you're left alone and unattended once you fall asleep under anesthesia. In reality, your anesthesiologist remains by your side the entire time you are under anesthesia, providing continuous care and vigilance. They are actively managing your body's responses to the anesthesia and the surgery itself, ensuring stability and addressing any potential issues that may arise. They meticulously monitor your breathing, ensuring adequate oxygenation and ventilation. They also closely track your blood pressure, administer fluids as needed, and regulate your body temperature to maintain optimal conditions. Essentially, your anesthesiologist is acting as your dedicated guardian, ensuring your safety and well-being throughout the procedure. The safety culture in anesthesia is incredibly rigorous and ever-present, with protocols and procedures designed to minimize risks and ensure the best possible outcomes. Understanding these facts about anesthesia can help replace fear and anxiety with trust and confidence in your medical team. The reality of modern anesthesia is far safer, more controlled, and more comfortable than the often exaggerated portrayals in fiction. Your secrets, and most importantly, your safety, are in the hands of highly skilled professionals, well protected by advanced technology and rigorous safety protocols. Your journey begins in pre-op, where your anesthesiologist confirms your details and answers last questions. A nurse places an IV for medications and fluids. In the operating room, you're connected to monitors for heart rate, blood pressure, and oxygen. You'll breathe pure oxygen through a mask, pre-oxygenation for safety. Induction is quick. The anesthesiologist administers medication, and within seconds, you drift into deep unconsciousness. Most people don't even finish counting backwards from 10. Once asleep, the team secures your airway with a breathing tube or mask, connecting you to a ventilator. Throughout surgery, your anesthesiologist continuously adjusts medications and monitors your vital signs. Every moment, your safety is their focus. You are never alone during this process. The entire experience is designed for comfort and protection. As you drift into the realm of anesthesia, it's natural to wonder about what happens while you're unconscious. While you're under anesthesia, you're monitored more closely than at almost any other time in your life. In fact, the level of scrutiny and attention to detail is truly remarkable. The anesthesiologist meticulously tracks your heart, observing its rhythm and electrical activity to ensure everything is functioning smoothly. Blood pressure, both systolic and diastolic, is continuously assessed to maintain optimal circulation. Oxygen saturation, indicating how well your blood is carrying oxygen, and carbon dioxide levels, reflecting how effectively you're breathing, are monitored in real time. These measurements provide a comprehensive picture of your respiratory status. Sophisticated alarms are in place to alert the team to even minor changes in your vital signs, acting as an early warning system. This allows for immediate intervention, preventing potential complications before they escalate. The anesthesiologist is always ready to respond. For complex cases where the stakes are higher and the potential for instability greater, advanced tools like arterial lines are utilized to provide continuous, beat-to-beat blood pressure data, offering a more granular view of your cardiovascular function. Temperature probes are strategically placed to prevent hypothermia, a common side effect of anesthesia that can impact recovery. Fluid and blood loss are meticulously managed, with intravenous fluids and blood products administered as needed to maintain adequate volume and oxygen-carrying capacity. The anesthesiologist oversees your entire physiology, acting as a vigilant guardian, constantly adjusting medications and interventions to keep you stable. This comprehensive monitoring frees the surgeon to focus entirely on the operation, knowing that your well-being is in capable hands. Safety protocols and checklists, borrowed from the aviation industry, where precision and safety are paramount, are rigorously followed to reduce errors and ensure seamless team communication, fostering a culture of safety. Before surgery even begins, the entire team pauses for a crucial time-out to meticulously confirm every detail of the procedure, from patient identity to the surgical site and planned interventions. This multi-layered system, incorporating cutting-edge technology, unwavering vigilance from the entire medical team, and seamless teamwork, makes anesthesia an exceptionally safe practice. Every possible safeguard is meticulously put in place to protect you, ensuring your well-being throughout the entire surgical journey. The operating theater, far from being a place of worry, is a zone of constant expert oversight where your safety is the paramount concern. As surgery ends, the anesthesiologist carefully reduces the anesthetic, timing your awakening with the final stitches. Pain medication is given so you wake up as comfortably as possible. As the drugs wear off, your natural breathing returns and you begin to stir. Once you can breathe and protect your airway, the breathing tube is gently removed, usually with no memory of it. You're moved to the recovery room, where nurses and the anesthesia team continue close monitoring. Expect to feel drowsy, groggy, or disoriented. This is normal. Nurses manage your pain, temperature, and any nausea. Once you're fully awake and stable, you'll move to a regular room or prepare to go home. The transition is smooth, safe, and closely supervised. Undergoing anesthesia can be a daunting prospect, and it's natural to have concerns. The biggest fears, feeling pain or not waking up, are often at the forefront of people's minds. But it's important to understand that these fears are specifically addressed by the very design of modern anesthesia practices. powerful drugs are used to block pain signals, ensuring you remain comfortable throughout the procedure. These medications are carefully selected and administered based on your individual needs. And your anesthesiologist, a highly trained medical doctor, continuously adjusts medications based on your body's responses in real time. They are experts in pharmacology and physiology, ensuring a safe and controlled anesthetic experience. The risk of fatal complications during anesthesia is extraordinarily low. In fact, it's lower than many everyday activities we undertake without a second thought. This remarkable safety record is thanks to advanced drugs, sophisticated monitoring equipment, and the vigilance of your anesthesia team. We utilize cutting-edge technology to track your vital signs and ensure your well-being. Anesthesiologists are not only experts in administering anesthesia, but also in handling any potential emergencies that may arise during a procedure. They are prepared to manage any situation, ensuring your safety is paramount. This level of expertise and preparedness makes the operating room one of the safest places you can be in the event of a medical crisis. The environment is meticulously controlled and equipped to handle any contingency. Of course, the level of risk associated with anesthesia can vary depending on your overall health and the complexity of the surgical procedure itself. Pre-existing conditions and the nature of the surgery can influence the anesthetic plan. That's why your medical team carefully tailors the anesthesia plan to your specific needs, taking into account all relevant factors to minimize any potential danger. This personalized approach is crucial for ensuring the safest possible outcome. Before your procedure, they'll thoroughly discuss any specific risks associated with your case with you, ensuring complete transparency and informed consent. You'll have the opportunity to ask questions and address any concerns you may have. It's truly remarkable to consider that over the past 50 years, advancements in techniques, technology, and training have improved anesthesia safety 50-fold. This progress reflects a continuous commitment to patient safety. While it's important to acknowledge that no medical procedure is entirely risk-free, the potential benefits of undergoing surgery almost always significantly outweigh the very small risks associated with modern anesthesia. The goal is always to improve your health and quality of life. Modern anesthesia is a true triumph of medical science and a testament to our unwavering commitment to patient safety. It represents the culmination of decades of research, innovation, and dedication. Ultimately, your well-being is always the top priority of your entire medical team. We are dedicated to providing you with the safest and most comfortable experience possible. General anesthesia requires trust, but it's trust built on science, training, and dedication. Your anesthesiologist is your advocate and guardian, focused solely on your safety. Understanding the process can turn fear into comfort. Open communication with your anesthesia team is key. Ask questions and share concerns. Every layer of planning and monitoring is designed for your protection. Surrendering consciousness is humbling, but it's also safe. With knowledge and trust, you can approach surgery with confidence, knowing you're in expert hands.